I'm Danielle, and I'm in my last year of Kinsci, and we're just all going to introduce ourselves, and then we'll get started on our presentation.
Hi, everybody. My name is Nicole, and I'm in my third year of biochemistry.
Hi, everyone. I'm Zaki for Khimani, and I'm in the first year of engineering.
So there are many barriers to receiving mental health care, but there are even more barriers for those in rural areas. And many of the barriers have been magnified or made worse by the COVID-19 pandemic and have allowed for greater identification of the barriers faced by many people in rural communities in New Brunswick. So there are 4 large groups of barriers that we have identified, and they're accessibility, availability, affordability, and acceptability. So from the accessibility standpoint, rural residents often have to travel really long distances in order to receive the services that they are in search of, and then they're also less likely to be insured for mental health services, and providers are less likely to recognize a mental illness when they do eventually get to see a mental health provider. And so availability, there's chronic shortages of mental health professionals, and mental health providers are often more likely to practice in rural areas, in urban areas, which are not close to a lot of the rural areas, making it much more difficult for people living in rural areas to access these places. And affordability, so some rural residents may not be able to afford the cost of health insurance, or they can't afford the cost of out-of-pocket care if they don't have health insurance. So this makes it really hard for them to access care. And then the final barrier is acceptability. So rural residents may be more susceptible to stigma of needing or receiving mental health care in small communities where everyone knows each other and the communities are very tight-knit. And then there also tends to be fewer choices of trained professionals, and this can lead to a lack of faith and confidentiality, as well as reliance on the informal care of family members, close friends, and religious leaders who tend to be have more stigma around mental health.
So some other barriers. So these barriers are also directly related to social determinants of health, which can impact specific social and economic groups. So groups such as Indigenous people, LGBTQ+, and Black Canadians experience more issues with income, education, and employment. These issues also can have an impact on accessing mental health care, especially in rural areas. These factors can also make it less likely for people in rural areas to seek mental health care, and this is further amplified by factors like lack of understanding and knowledge about mental illness, sometimes even among healthcare staff, prejudice or stigma towards people with mental disorders, often based on fear and unease, secrecy about mental illness in the community, and general hesitancy to seek care and perception of a lack of confidentiality and privacy in small towns. So when looking at trying to improve the mental health care in rural areas, it's important to acknowledge a place-based approach, because what works in one place will not necessarily work in another place, even if we're trying to spread it out in the same province. So to be effective, there's simply no one-size-fits-all approach to delivering mental health services in rural and remote communities. Therefore, using a place-based approach will allow for an approach that considers a community's capacity, socioeconomic background, and cultural landscape, and underlying inequities in order to provide solutions that address location-specific issues and community-based issues.
These issues and barriers identified relate directly to case of Hans, who experience fear of accessing mental health care as a result of stigma and lack of knowledge about available resources. Hans believed that his only option for getting help was going to the emergency room, which unfortunately does not have enough resources for providing adequate mental health. Luckily, when Hans confided his co-worker, he was able to learn about the CHIMO hotline. But Hans should have been educated on his options before going to the point where he felt that he had no options. If Hans knew more about the available resources in New Brunswick and had been educated better about the mental health, his situation may not have gotten to a point that it did. In order to address the disciplinaries in mental health access in New Brunswick, we have created two proposals in order to promote mental health resources, decrease the stigma around mental health, and increase the mental health education. Our short-term proposal is New Brunswick mental health website. Along with providing the services available, we would also provide a section on available courses and workshops in New Brunswick for those who looking further for educate themselves on mental health.
So, although websites like the Canadian Mental Health Association and the newly created Bridge the Gap website already exist for youth, it is quite difficult for New Brunswick population to navigate between multiple areas on the internet and find the resources that they need for mental health services. Thus, we believe creating one website combining these existing resources and providing a place where all things mental health can be found would be a great benefit for New Brunswickers. It is important that the website offers a variety of topics to learn about, as well as offer affordable options for dealing with mental health. There are many websites and online resources available already, but they're all on different websites, which is a really big challenge when trying to navigate different mental health resources. So, our website model has been based on the mental health website that has been created in Australia, which is called Beyond Blue. And this website provides a singular site to learn about mental health, learn about how mental health can affect various populations differently, and the resources and services that are available. So right now, there's lots of mental health services available. So in this section of the website, we will include the services that are available. So some of them that are already available are Bridge the Gap, which is a new online resource for guidance and support for mental health. Wellness Together Canada, which is an online portal created amidst COVID, and this provides free 24/7 mental health and substance use support. And then there's the Canadian Mental Health Association, who have lots of resources. The CHIMO Helpline, which is a 24/7 phone line for crisis intervention. Then there's also the Hope for Wellness Helpline, which is also a 24-hour crisis phone line, and they offer services for mental health and counseling and crisis intervention to all Indigenous people across Canada. And then you can also contact your primary health provider or your local addiction and mental health service office if you're experiencing ongoing persistent stress and are unable to carry on with normal life. Some other options are reaching out to a psychologist, a counselor, or a social worker in your area. And then some private health insurance policies cover some of these costs. And then if you're looking for psychologists, you can reach out to the College of Psychologists of New Brunswick, and they have a directory of all the people who are available. And then there's also the Mobile Crisis Unit, who you can call and they will help you if you're in crisis. And then there's also faith-based support. So many people who are struggling can reach out to their faith community for support. And finally, the last option is calling 911 for immediate crisis or if you're in need of immediate assistance.
The next section on the website would include online courses and workshops. And this is based off of that finances and physical access are clearly a large indicator of why most New Brunswickers don't choose mental health services. And according to an article from Frontiers in Public Health, some social determinants like family support, social support, and food insecurity are identified as important determinants of mental health in the younger New Brunswick population. So providing online courses and workshops at no cost can encourage those who are struggling and don't want to get help, that get the help they actually need. So New Brunswickers all have a population stemming from different backgrounds, and it can be extremely difficult to find resources that are relatable and allow you to feel like you're being heard. and as a consequence, most refrain from expressing how they feel because of the stigma associated with vulnerability. In Hans's case, had he not spoken to his coworker about seeking the help, he might have ended in a different situation. And this highlights the importance of our goal, which by providing online courses and workshops, we can cover a variety of topics and help this serve as a conversation starter for those who are struggling, whether it be reaching out to a friend or a healthcare provider or even doing some self-reflection. So the following courses and workshops are provided to Canadians at no cost and are important to include on the website. So first, there is the Centre for Addiction and Mental Health, which is Canada's largest mental health teaching hospital and is fully affiliated with the University of Toronto. They provide an array of resources to tackle anything related to mental health. Some examples include the Mental Health Illness Addiction Index, which acts as a dictionary for all things related to mental health. Secondly, they offer the Mental Health 101, which is a course site, and it contains a multitude of tutorials on mental health topics. Users are able to self-enroll in courses, and they are able to take quizzes and actually see if they're learning what they're supposed to, which is really nice. So topics covered include anxiety disorders, diversity and health equity, veterans and mental health, and many more. They also provide a directory for guides and publications, which anyone is able to access, and it has reliable sources for any topic regarding mental health, and it's all accessible from the comfort of your own home. The second option is jack.org, which is an accessible resource for the younger population of New Brunswick and is Canada's only charity training and empowering young leaders. The second leading cause of death for Canadians aged 15 to 34 is death by suicide, but jack.org provides resources which hopefully can help lower this number in the future. Resources include Jack Talks, which are similar to TED Talks and are held by trained and certified youth speakers to help educate and engage and inspire youth to take action. Secondly, they offer Jack Chapters, which are trained youth groups that work year and round to address stigma and stereotypes surrounding mental health. Jack.org also provides resources for multiple backgrounds, including Indigenous youth, which the mental health is greatly impacted in New Brunswick. Much more is available on this website, and it provides a safe space for youth to learn more about what they're dealing with and get the support they need. Lastly is the Mental Health Commission of Canada, which leads the development and introduction of new programs and tools for mental health and wellness. They offer training in a variety of topics, including training for specific genders, age groups, and ethnicities. Each program offers different group sizes, delivery methods, and all the training is offered in both English and French, which is important because a lot of the rural areas in New Brunswick they speak French mostly, so this is important for their training. And the training that's offered includes mental health first aid, which helps provide help for someone who's developing a mental health issue or experiencing a worsening symptoms or are in a mental health crisis. And this is important, for example, in Hans' situation, if his parents had taken this course, they could have provided him support, and they have a course that's designated for adults who interact with youth, so his parents could have had the tools and knowledge to actually support him during his crisis. This course can also be implemented in rural schools and allow teachers to be trained and help support their students in the classroom. The Mental Health Commission also has a program called Headstrong, which is a youth-led club, and they have summits throughout the year that aim to equip and inspire youth to reach out and bravely speak about their mental health. So these are just a few of the great resources Hans could have used had he been informed they existed.
The website will also include a section on different populations and how mental health can have different effects on them, especially when New Brunswick has become this multicultural and a lot of international students coming from all around the place. Resilience varies in groups of people as well as on the individual level. Our societal constructs have stigmatized and marginalized mental health for groups of people. Physiological and psychopathology also plays a factor, and how different individuals can behave in response to trauma and stress. The more resilient the person is, the better they are to cope with adverse conditions. Adverse childhood experiences can contribute to depression and resilience. The men and women both experience depression, but their symptoms can be very different. Because men who are depressed maybe appear to be angry or aggressive instead of sad, their families, friends, and even the doctors may not always recognize the anger or aggression as depression symptoms. As per Albert in 2015, major depression is growing in all over disease burden in Canada around the world. It is predicted to be the leading cause of disease burden by 2030, and it is already the leading cause in women worldwide. Why is then depression prevalent among women? The triggers for depression appear to differ, with women more often presenting with internalizing symptoms and presenting with externalizing symptoms in men. For example, in study of diazotic twins, women displayed more sensitivity to interpersonal relationships, whereas men displayed more sensitivity to external career and goal-oriented factors. Women also experience specific forms of depression-related illness, including premenstrual dysphoric disorder, postpartum depression, and postmenopausal depression and anxiety that are associated with changes in ovarian hormones and could also contribute with increase in prevalence in women. However, the underlying mechanism remain unclear. Thus, treatments in specific to women have not been developed. Highlighted 2.2% of youth had clinically significant depression symptoms or diagnosis, and girls had greater order of depression than boys. So the depression is common response to trauma that is not solely reflective of pre-trauma difficulties. So mental health also impacts populations such as LGBTQ+, indigenous people, multicultural people, immigrants, older people, children, and youth. Since mental health impacts these populations differently, it is important to acknowledge that this provides this and provide information for each respective population. And I think the main age group to be focused on is probably from 15 onwards, as they're going into pre-adolescence age, and this is, I think, where they're most vulnerable.
So the last part of the website is going to be personal statements and connections. So this will be a peer support group in the form of an online forum where people can talk about the mental health struggles that they are experiencing. And there's going to be multiple forums. So each forum is a space where people can talk about a specific mental health struggle. We believe this would be helpful as a study shows that peer support groups are effective for supporting personal recovery. This is going to make it much easier for people to find and connect with other people that share the same problems that they share, and as well as get advice and feel less isolated. This is also a really good way to effectively combat stigma around mental health, as seeing other people's contributions would normalize mental illness and seeking support for mental health. So in order to advertise the website, we would advertise it in schools, communities, and online in order to further educate people about the available resources and to decrease stigma. In rural areas, there is a barrier that we have identified that some people do not have computers or they can't access the internet. So in order to acknowledge that, we would have a printable version of all the available information to provide to those who are not able to access the website. And there will also be a chat line run by volunteers where those in rural areas can call and speak to someone who can direct them to the resources and mental health specialists in the province. Since this can be a little bit difficult having the online chat forums and volunteer portals, it would be closely monitored to make sure that everyone is following the rules and there's no danger from the site.
So now we'll talk about the school-based programs. So our long-term proposal is a school and community program, and the program would be closely modeled after the Ontario mental health school programs. The School Mental Health Ontario believes that every Ontario student deserves to have access to evidence-based mental health promotion and prevention programming. Our model in Ontario is designed to help students flourish and remain resilient as they journey through life. This statement is very true, but it should not be limited to Ontario students, which is why we believe New Brunswick should be should build and adapt from Ontario's school program for mental health. The 4 principles identified for school mental health support in Ontario are mental health promotion and prevention, tiered intervention, implementation science, and sustainability and scale up. In order to increase mental health education, we believe that teachers and community leaders should take part in Kids Have Stress Too and ASSIST, which is Applied Suicide Intervention Skills Training, both through the Canadian Mental Health Association, New Brunswick. Once they have taken these courses, they would be able to implement them in the class and show what they have learned, and also have a better base knowledge in order to educate students. Since stigma from parents, guardians, and/or family can be a large barrier, we also want the teachers to be able to teach the parents about the mental health and the available resources at parent-teacher interview nights. Using resources like Jack Talks, Jack chapters, and Headstrong summits allows professionals outside of New Brunswick to provide a different perspective to mental health and help engage and educate our population. Making online resources a permanent part of New Brunswick health curriculum can help engage students in discussions related to mental health early on in their development, and this can significantly reduce stigma surrounding struggling with mental health disorders. If schools have designated personnel with training for health crisis, they will have the proper tools to provide support for those struggling.
To reduce the cost and provide more accessibility training and workshops that require fees can be taught in group settings to accommodate for those who are financially suffering. Also, these workshops could be shown in evenings on university campuses to help support students as well. A large issue that results in people not receiving treatment is lack of awareness. Most do not know the programs exist, and it is important that advertising be created and parents be informed their children are partaking in these curriculum. Again, this can encourage conversations about mental health at home with children and their parents. The next slide, please. Okay, so
Since we are already at the 20 minutes, we did have more information, but here's our budget. And if you have any questions, we can better explain it. And then we'll leave it just on I'll show you our reference slide. But then also we just have our conclusions with our final thoughts and just summing everything we said up. But thank you.
Thank you so much. And I just want to give another shout out for you folks overcoming the adversity of losing a team member unexpectedly. So amazing job and thank you.
Hello, can you hear me? Okay, so this has gotten even weirder now, where my microphone is on in Gather, and so there's this weird feedback thing going on. Okay, but thank you so much for the presentation. I really liked the way that you broke down barriers and your emphasis on place. So I was wondering, what kind of specific underlying equities do you think affect Hans?